I know that millions of Americans have thyroid diseases, and most of them women. There are a lot of symptoms that could be basically, fatigue and gain weight, or maybe, losing weight. But I would like, to find out your side, what are the symptoms of this disease, and maybe are there any prevention methods that a person, could take, for a healthier lifestyle, I guess.
So, would you like me to begin?
Yeah,
in
please.
this part of the world, meaning North America, where there's enough iodine in our diet, the major prevention of thyroid disease is already taken care of by most of our diets. In other parts of the world where there's iodine deficiency, that's a common cause of thyroid enlargement and the most common worldwide cause of an underactive thyroid. As far as prevention, one doesn't have many preventive efforts, except with some exceptions. That is, in pregnancy, women should make sure there's enough iodine in their diet. And essentially, the best prevention is early diagnosis to prevent the condition from progressing, because early diagnosis leads to earlier treatment, and the earlier treatment, which is eminently successful, will prevent the problems from becoming more severe.
That's, I guess, it's very interesting that there is, no prevention for this disease. Then if there is no prevention and a person does have a fairly, healthy lifestyle and takes enough, iodine daily, maybe, what are those, critical symptoms that we need to watch for so we can actually take an early step and go to the doctor and be diagnosed properly?
Well, let me just step back as far as no prevention. One of the things that can cause thyroid problems is radiation, but it's debatable whether you can say you can prevent your radiation exposure either for medical reasons or based on climate. But as far as the symptoms are not specific, but the key is to be familiar with the way the thyroid can affect your organ systems, whether it's gaining weight, losing weight, slowing down, speeding up, and to basically be aware of what's normal for you. If you went to a doctor for every time you had a symptom like that we all experience from time to time, you would be spending a lot of time and getting nowhere. But if this was very different, that is, it changed and it just wasn't you for a while, raise the question about whether it could be your thyroid.
That's helpful. That's helpful. Also, you know what? I have a different question. Interesting, because I know that women will be asking, can a person actually experience cravings if there is any disruption in thyroid function?
Unquestionably. If you have an overactive thyroid, one of the characteristic symptoms is an increased appetite. So people with an overactive thyroid can eat 2 or 3 times more than they normally eat, and in fact have frequent bowel movements as a result of eating a lot and having a sped up metabolism. So craving and eating a lot without gaining weight or in fact losing weight is a classic symptom of a severely overactive thyroid.
And can thyroid disease lead to any other disease, any other disruption of organs?
Well, there are 2 ways of looking at it. Thyroid disease, which most commonly is an autoimmune disease where the body produces antibodies against other hormones, can be associated with all sorts of other autoimmune diseases, whether it's rheumatoid arthritis or lupus or type 1 diabetes. On the other hand, if you have other diseases, if you have a weak heart or you're susceptible to certain kinds of problems, whether emotional or otherwise, your thyroid being off can make it much worse. For example, if you happen to be afflicted with depression, having an underactive thyroid can make it worse. If you happen to be an anxious person, having an overactive thyroid can make it worse. If you have a bad heart, an overactive thyroid can strain it.
All right. And then once a person has been diagnosed properly by the doctor, what are those, steps that would you, of course, it's very individual from person to person, case to case, but what are those, maybe general steps that a person could lead and still experience a normal lifestyle?
Well, the good news is that 90% of the problem is diagnosing it accurately, because both an over and an underactive thyroid are both virtually without exception completely treatable, and we believe people can be restored to their normal selves once they're properly diagnosed and medicated.
That's wonderful. Well, and what are those resources, that you would recommend so people can actually go and self-educate themselves and
Well,
take it, to notice?
well, we're in our 18th year of our thyroid awareness campaign, and thyroid awareness, that's one word, thyroidawareness.com. That's where you can find the current information and answer everything you want to know about the thyroid and more.
Absolutely. Dr. Garber, thank you so much. I think that's a very good beginning, and there is a lot of information, not, for some, easily to digest, but I will pass it on. I will jump on this campaign and support you because, this is one of the things that we need to be aware of and do something.
Well, thank you very much.
So much.
Thank you.
Thank you.
Okay. Bye-bye.
Bye.
Bye.